Hi, my name is Jeff Correia, and I'm a return patient to Houghton Physical Therapy. I had a right knee replacement in November of 2021, and I had a left knee replacement in November of 2022, which is what brought me here recently. And I had actually been progressing from my surgery much faster than I had been for my first knee replacement, and I was able to do a lot more, a lot quicker. But when I came in that Wednesday before Christmas, I really had a lot of muscular pain, and he could really tell from the way that I was walking that there was something going on. Yeah. I had just kind of thought that I had overdone it, but he's kind of felt around. It's like, no, I can feel some knots here, and he suggested that dry needling would potentially alleviate some of the soreness that I was having. It almost felt like a pulled muscle. But I know I didn't pull any muscle because I hadn't been moving it enough to pull any muscle. But that's the way it felt, and he said, no, dry needling might help me relieve some of that pain, that inability to move, and he was right. The dry needling itself was really very painless. You think they're going to stick some needle into you, you think it's going to hurt, but it doesn't hurt at all. As a matter of fact, you can barely even tell that he's inserting it when it's in there. You don't even know whether it's in there or whether he took it out. So that was really easy. And he recommended the day of my needling that I go home and rest, but heat on it the next day, take it easy the next day. And by Friday, which was the 2 days after Wednesday, it was unbelievable what I could do. I came in, I actually saw Alex the next day. I showed him, I lifted my foot up on the table. It was really such a relief that it was unbelievable how much relief that I actually got. I literally couldn't believe it. At home, I was going up the steps. My wife said, oh, you're racing up the steps compared to what you'd been doing. And I was able to do a lot more for a lot longer. So there was definitely some type of muscular release that I got that sort of propelled me along. So I mean, I strongly recommend it. If the therapist says that it's going to help you, and I've done it twice, and I'm going to do it again today because I'm feeling sort of the same way. When you do a lot of exercise on it, it's not surprising that you can sort of beat it back into the same condition.
Yeah, so dry needling is not just for people, post-op, right? It could be people who have chronic pain or just pain in their neck, they're anywhere in their legs, their butt muscles, things like that. And if it's not better with regular stretching, exercise, and other manual work, then the next step might be dry needling, a little bit more advanced therapy, getting right into that area that's restricted or painful. And it gets in there, it can release the muscle, it can cause instant relief, maybe some soreness because you are putting a needle in you, but ultimately the effects can be great and instantaneous. So it's something that I recommend for people, especially who've had other forms of treatment and maybe have not had benefit or are looking for like an instant relief. It can be really, really beneficial. And it might not, fix everything on the first visit, but we're looking for progress on the first visit, and then ultimately, it will get better over time.